Knock, knock, knock.
Come in.
Hi.
Hi.
How are you today?
I'm okay.
Provide privacy. Do hand hygiene. I am Heather. I'm going to be your nurse today. Can you tell me your name and date of birth, please?
Macy Downs, 1893.
Okay. And do you have any allergies?
Nope.
Okay, I'm just going to verify your name and to see if there's any allergy bands. Nope. All right. I am here to do a head-to-toe assessment on you and check and make sure that you are basically good from head to toe. No bumps, bruises, lesions, rashes, anything. Do you know where you are?
Sanford Hospital in Fargo.
Do you know what time it is?
I think it's 7 o'clock.
Okay, and do you know why you are here?
I had knee surgery.
You had knee surgery. Okay, and are you having pain in your knee?
I'm having some sharp pain in my right knee.
Some sharp pain. Okay. Can you rate it on a scale of 0 to 10, 0 being the worst, 10 being or 0 being the best, 10 being the worst?
Probably like a 7.
Okay, and is there anything you can do to help alleviate the pain?
I don't think so. They've been putting hot packs on it, and they gave me Tylenol about an hour ago.
Perfect. Okay. And you said it was kind of throbby?
Sharp.
Sharp pains? Okay.
Yep.
All right. Well, we're going to start here. We're going to take your vitals, get your blood pressure, temperature. Do this. This will measure the oxygen. Get your temperature. All right, looks good, 98.7. Your oxygen's at 97, so that looks good. And your blood pressure is 126/80, so that looks good. And I monitored your respirations while I was doing this stuff, and that is very good. Take your pulse. They're equal and very strong. Okay, so now I am going to just kind of check your head and stuff over here. Feel for bony prominences. Check behind your ears. Look for bumps, bruises, rashes. Everything looks good. Can you puff out your cheeks for me? All right, stick out your tongue. Smile. Looks good. Okay, follow my pen light here. Your eyes are reacting simultaneously and your pupils look good. Check up in your mirrors. Everything looks pink, moist.
Good.
That looks good. You have good facial symmetry. Now I'm going to go down and I'm going to check your chest for any rashes. Good color, moisture, integrity, temperature. All right, check your shoulders. Check your bony prominences. No IV pick lines, no anything, so that's good. Check between your fingers. Check your capillary refill. That looks good on that hand. Check over on this side. Check your bony prominences. That looks good. Good color, moisture, integrity, and temperature on that arm. Check your cap refill. That looks good on that hand. Now I'm going to move to your stomach here. And I'm going to check for any rashes, bumps, bruises, lesions, good color, moisture, integrity, temperature. Now I'm going to listen. Make sure you have good vowel sounds in all 4 quadrants. Listen for a minute. That sounds good. I'm going to check your apical pulse, which is mid-clavicular, fifth intercostal space right below your breast, and I'm going to listen there for 1 minute. Sounds very good, very strong. You have regular rate and rhythm,
Good.
and your vowel sounds sound great. So I'm just going to push here. Does that hurt at all?
Nope.
Any tenderness, any pain?
No, not at
No.
all.
Okay. When is the last time that you voided?
I would say this morning.
This morning. And was it normal? Did it have a different color? Did it burn? Do you have a really quick frequency to go? Or was
No,
it pretty normal?
it was pretty normal.
Okay. And are you able to pass gas?
Yes.
And how about a bowel movement? Have you had a bowel movement today?
Not today, but I did last night.
Okay, and is that normal for you to not go every day?
Yes.
Okay, and what was it like last night? Was it good color? Were you constipated? Or do you have diarrhea?
Nope, I would say it was good color.
Okay. And it wasn't loose at all?
Nope,
Okay.
I just haven't eaten too much since surgery.
Okay. I'm going to put on some gloves here, and I'm going to check your peri area. Make sure you're clean, dry, and intact. And are you continent or incontinent?
I would say I'm continent.
You're continent, so you have no trouble getting up and going to the bathroom when you have to go.
Nope.
Okay. And how do you get to the bathroom? Do you use a walker, wheelchair, cane, anything like that?
I've been using a walker while I'm in the hospital.
While you're in the hospital, that's probably a good idea. And do you go to the bathroom? Do you use a commode, bedpan? Do you get up and go to the bathroom by yourself?
I get up to the toilet by myself.
By yourself, okay. And you said you use a walker.
Yep.
Do you need any help getting out of bed or while you're in bed to get out? Do you put on your call light to have somebody come and get you, or do you go by yourself?
I usually just go by myself.
Okay, sounds good. Well, I'm going to check your groin here, and you are clean, dry, and intact. Okay. No rashes, bumps, bruises. Get my gloves off, do hand hygiene. And then I'll pull your gown down for you. And then I'm just going to put this down here, and I'm going to check over your back and your legs. Here, we'll do your legs first. They have good moisture, color, temperature, and integrity. Check your bony prominences. Your heels look good. Check between your toes. Check capillary refill, which looks good. I'm going to come to this side here and check this leg. That all looks good. No bruises, no scratches, scrapes. Check your heel. Check between your toes. Check capillary refill. There's no edema present in either of your legs, so that's good. Check your pulse. Those are very good, nice and strong.
Good.
Okay. Actually, I'm going to leave this down here. Okay. I am going to have you turn so I can check your back, listen to your lungs. Do you need help doing that?
Probably a little bit.
A little bit? Sure, I can help you turn over here. You get these on. Okay. I'm going to listen to your lung sounds in all 7 spots, making the S pattern. All right, breath sound clear. Your lungs sound great. Are you experiencing any shortness of breath at all while you're laying in bed?
Nope.
Okay. Your coccyx looks clean, dry, and intact. And you said you were caught in it, correct?
Yes.
Okay. And your back of your legs, your heels, all your bony prominences look very healthy, very good. Good color, moisture, integrity, and temperature. Okay. Some hand hygiene here again. There is one last thing that I have to show you. Have you ever seen one of these before?
I don't think so.
Okay, this is called an incentive spirometer.
Okay.
And what it's going to do is while you're kind of laid up in bed here, it's going to help your lungs stay clean and free of pneumonia and stuff since you're not able to move around very much.
Okay.
Basically what you have to do is we want you to do it 10 times an hour while you're awake. You can do it during TV shows, it's not noisy, commercials, whatever. But you just hold the handle here and you take the mouthpiece and you suck in as hard and as far as you can go, and it will measure how much you did, which will be your goal for each time that you do this little machine here. So can you give it a try for me?
Sure.
All right. Go ahead and suck in. Perfect. Thank you. Do you have any questions regarding this?
No, I don't think so.
Okay, sounds good. Well, everything looked good. From head to toe, your vitals were good. Is there anything I can get for you?
I don't think so.
Okay, well, my name is Heather again, and I will be your nurse for the rest of the night.
Okay.
I'm going to get your call light here and put that. I'm going to put your bed down a little bit.
Okay.
I'm going to get you some fresh water. And I will put this stuff right beside you with your incentive spirometer. And if you need anything, just ring your call light and we will come in and see what we can do for you.
Okay, great. Thank you.
Thank you.